the odds of you experiencing debilitating back or neck pain in your lifetime is extremely high. Some sources say there's an 80% chance. So what will you do when this happens? Well, you basically have 5 options if you want some help for this. Well, you could do nothing and just wait it out. You could go see a massage therapist. You could do some exercises or maybe see a PT. You could go see your medical doctor, primary care provider, maybe get some over-the-counter pain relievers, or you could see a chiropractor. Now, I think we all know where my biases lie in this question, but all bias aside, what will each of these options really do for you? Doing nothing is usually the result of care being perceived as too expensive, or maybe the person just thinks it's not that big of a deal. They'll walk it off. But the truth is, when your back or neck is in serious pain, it took time to get there. It's been grinding down for a while, and really your body's just telling you that there's an emergency. And what do you think it'll cost you in the future if you do nothing now? The situation, the condition will only get worse, and it'll become harder to repair, and it will cost you more in treatment bills, in lost work, and in quality of life. There is a better option. You could get a massage. Massage is great, wonderful. And for most people, it seems like getting in there to work out tight muscles, get rid of knots, loosen things up in general. This really seems like the right option. In almost every case, though, massage is too superficial for the specific problem. What we want to do is we want to get at the cause of the tight, restricted muscles to really bring you the result that you want. See, massage, it's kind of like buffing and waxing a car. It's good. But really, if you still have rust and dents and a glowing check engine light, this really won't solve the problem. There is a better option. Now, you could go and do exercises on your back and neck yourself, or you could go see a PT who will give you very specific movements and workouts for it. Now, PTs are the best at what they do, especially when it comes to rehabilitation after injury, by retraining your muscles and helping you get better strength and flexibility. We love the PT. However, the cause of your pain is likely from spinal misalignment, and exercise on its own will not solve your problem. For instance, if your car was out of alignment, would you then go and race it? You see, it would only grind it down further, make the problem worse. Now, the muscles around your spine that may not be firing properly, they just hang there and they do what they're told by nerves that are coming out of the spine. There is a better option. Now, you could go to an MD for help. Now, MDs have a wide range of knowledge of the human body, and we have incredible respect for them. But when it comes to complaints of back or neck pain, they can really only do about 3 things for you. They can give you pills, or send you out for a needle injection, or maybe even refer you out for a surgery. Now, we've all needed some pain relief at some point, of course, but just understand that pills and needle injections, they don't actually do anything for the problem. They just temporarily cover up the pain, and in a case like this, they actually let the underlying problem just get worse. Now, if you even let the problem get bad enough, you may just need that spinal surgery, which is going to end up costing tens of thousands of dollars and will result in you having a fused spine with less movement and less function. Now, in order to hopefully avoid something like this, let's look at our next option. You could see a chiropractor. The most beneficial to you of these options, the cheapest, and statistically the most likely to help you get out of your neck and back pain. Some sources say that 80 to 95% of patients who see a chiropractor see significant reduction in pain and improved mobility. And you know what? That's not even the best part. Decreased pain is a common side effect of chiropractic adjustments, when the main point is that really your brain and spinal cord end up having better control over all of the parts of your body, which is going to improve your healing and get you closer to 100% function. Massage, PTs, MDs, these are all great supplementations to chiropractic care. You'll notice in many chiropractic offices, massage is also offered. Great. In personal injury cases especially, PTs being part of your health team along with chiropractic gets you some amazing results. And if an MD has to toss you some medications to help you manage some serious pain while the chiropractor works on the problems in your spine, great. We all need it sometimes. The main point though is that chiropractic, it's your foundation for health. All right. And except for emergencies, it really should always come first. Now, if you also have neck or back pain, absolutely go see a chiropractor, because odds are it's going to help your pain tremendously. But more importantly, going to help you get your nerve system the proper control it needs so that you can achieve optimal health.